topic. This is what this is really all about, is trying to, for those who have not yet ventured off into Medicare, kind of a little introduction and why you should be selling it and why it should be part of your portfolio of products, okay? So we're getting ready for the annual enrollment. That's kind of what leads up to this. That's kind of the opening salvo for Medicare every year. And so here's what we're going to try to answer for you here today is these questions of, why should you sell Medicare? When can you do it? What do you need to do to prepare? And for those who I'm unable to convince, a little bit about the Medicare supplement. Even that is going to be education about Medicare alone too. Okay, so as we proceed through here, I got quite a bit of material, so I'm going to really kind of just jump in. It's just me, so when it comes to questions and all that, I do have the chat panel up, and I can see that. I'll try to answer them, but normally they would have a separate person here with me that would be answering the chat and doing that stuff at the same time. So we'll just kind of take it from there. Okay. So just trying to answer that question about what is Medicare, and that kind of sums it up there. It's it's a federal health insurance program administered by the Centers for Medicare and Medicaid Services. You're going to hear that referred to as CMS. Okay, even though there's two M's, it's just CMS. Now, when I say a federal program, understand that there are no other options. You can stay on your program if you have health insurance from an employer. I mean, you can stay on that and not go on to Medicare. But you can't go out and get private insurance. I mean, you can't get your subsidized ACA plan anymore. You cannot go and purchase a major medical plan from one of the carriers. I mean, it's Medicare. I mean, all the other plans that you can purchase around Medicare are just going to help you with your Medicare, okay? But Medicare is it once you've turned 65. Now, for those who did have an ACA plan, one of the things you want to advise them of is, yes, you can stay on that plan until the end of the year. But what you would need to know is that once you turn 65, you are no longer eligible for the subsidy. So if that plan was being subsidized, you're setting yourself up for a nice tax problem at the end of the year. But for those who stayed on an employer health plan, no problem at all. I would usually recommend that they enroll in Part A of Medicare, not Part B at that time, just Part A. And it'll even help with that, okay? So those are kind of a little bit of information about that. Now, who's eligible? We'll start off with everybody 65 years of age and older. Those that are under 65, it's going to be certain disabilities. Maybe they were born with them, or maybe they developed them later on, like Lou Gehrig's disease, ALS, or something like that. But if you're under 65 and you have end-stage renal disease, which is called out specifically, doesn't matter what your ages are. If you go into kidney failure, you're going to go on to Medicare. And U.S. citizens or legal residents who have lived in the U.S. for at least 5 years, I mean, we're talking about eligibility to go on to Medicare, not necessarily meaning that it's going to be at zero cost to them. And what are some of the costs? Well, just like any other insurance, premiums, deductibles, co-pays, and co-insurance. Okay, they're going to all be there. So Medicare itself is in 4 parts. And understanding these 4 parts is really the key to selling everything, okay? Because once you've explained how Part A and Part B work, most of the time at that point, most people, there's always a few, that don't. For most people, it's like, how do I sign up? Okay, because it is pretty, yeah, I would say it's bad insurance. So that's not true. It's just that it's not the panacea of ending of all the cost in that grade. You can literally wind up broke on Medicare if something bad happens. So let's just start there with Part A. It says inpatient hospital. I always like to stress inpatient because that is not going to cover you for outpatient stuff in Part A. That's going to fall under Part B. But Part A is when you're in the hospital, but it's not just in the hospital. Okay, so it's inpatient hospital stays, care in a skilled nursing facility, hospice care, okay, and some home health care. I mean, they'll just come to your home and take care of you. Now, most people are going to get premium-free Part A. Now, if you don't qualify for premium-free Part A, you can buy Part A. People that wind up buying it are those who never worked, okay? In other words, you had to pay into your Medicare. One of the reasons that it's premium-free is that you've already paid for it. Because if you did 40 quarters work, that's 10 years worth of work, where you paid into the Medicare program, you can now get Part A without having to pay a premium. So when I think of, I always hear, stuff battered about the, you came into the country and now you're getting all the free medical care. Well, no, you're not under Medicare. If you're over 65, that was the only one you could get. And if you didn't work for 5 years, for 10 years in the country and paid into Medicare, you would never get it at no cost. So if you had to pay for Part A, and many people do, I'll give you those groups that have to pay for it, or the immigrants who came in and didn't have 10 years worth of work, and trust fund babies, those who never worked a day in their life because they lived off the trust fund. Okay, so those people will pay $458 a month for Part A. Okay, now if you work some, but you did between 30 and 40, you didn't do the 40 where you got it at premium fee, but you got it up to maybe 30 months, you get a reduced cost of $252. Now, in 2020, and this changes every year, the deductible for Part A is $1,408. And this is one of the things that I use for selling Medicare supplements and Advantage plans, is that is not, and I repeat, is not an annual deductible. That is an event. Okay, you got put into the hospital, and you're going to have to, that's your deductible for that hospital stay. Now, the way the rules work, they call it a benefit period, which with a lot, it's a government program. So roughly, 90 days is your benefit period. And so you went to the hospital, you stayed for a while, or however many days, a couple of weeks maybe, whatever, and then got back home again, and then were not readmitted to the hospital within 90 days, you pay it again. So kind of worst case scenario is you could pay that 4 times in 1 year. Okay. Now Part B. Part B is your medically necessary services. So, doctors, services, supplies, anything needed to diagnose or treat your medical condition. And of course, it has to meet the accepted standards of medical practice. So you have to be careful if they get off into some of the experimental things that may not be covered by Medicare. Preventative services, and that's healthcare to prevent things like the flu, so it's going to cover flu shots, or detecting cancers especially at an earlier stage where it's the prognosis of getting it taken care of are good, right? Where you're going to recover from it, where the treatment will work best. And it's also going to cover things like medical equipment. Now the standard Part B premium, and again, this is 2020, it changes every year, is $144.60. So that's the monthly premium. Now, in 2020, we also had the Part B deductible. Now, the Part B deductible is $198. Okay, that too changes from year to year. So after you meet the deductible for the year, you'll typically pay 20% of the Medicare approved amounts for everything else, doctor visits, outpatient stuff, and any kind of durable medical equipment. Now, Part A and Part B together, okay, those two are referred to also as original Medicare. Okay, so if somebody, where the terminology is all I have is original Medicare, that means all they've got is Part A and Part B. So that brings us to Part C. Now, Part C is just another name for Medicare Advantage plans. Now, Medicare Advantage plans are administered by private insurance companies contracted with Medicare. You still have to have your A and B, but instead of you paying the deductible for Part A if you're hospitalized, or your deductible with Part B and then 20% of all the costs, you're going to be in like an HMO or a PPO plan, okay? And they'll cover everything that original Medicare did, plus many of those Advantage plans will cover extras, and I'm talking dental and vision, things like that. And then there is the final, which is the newest part of Medicare, which is called Part D, and that's your prescription drug coverage. Now, it's the federal program for Part D is simply an outline of coverage. It does not provide any coverage itself. It tells all of the private companies what their Part D plan must contain. Okay? So it tells you, what the maximum deductible can be and what the maximum co-payments and co-insurance can be. So those are what they would call the model from the government around which all the Part D plans are built. Most of them are far better than what the government outline requires. Now, you're going to pay a monthly premium to an insurance carrier for your Part D plan. And then in return, the insurance carrier is going to have a network of pharmacies for you to purchase your prescriptions from. Okay, that's kind of very simplistic and in a nutshell, but for this point in understanding Medicare, that's about all that you're going to need. Now, the next thing we'll kind of look at is how does somebody get their coverage? Okay, so they've got some choices, and that's you can either start off with the Part A and Part B and have the original Medicare, meaning you have your hospital insurance and your medical insurance kind of together there, and that is a basic requirement for everything. Everything is going to build off of that. So if you want to just stay with original Medicare, that's great, but many people don't like the liability of that comes with original Medicare. Like I've always put it like this, Medicare out of the box or original Medicare, however you like to call it, is if you have that Part A and your Part B, you pay your premiums plus that 20% co-insurance. So I always look at it this way: if you could find a doctor who would see you for $100, your portion would be $20. Now, if your surgery cost $100,000, your portion would be $20,000. Medicare collects the payment at time of service. Okay, so when you go in for that surgery, or you go in to have that doctor visit, they literally collect the money or want a check or credit card at that time. or you get a Medicare Advantage plan. So that's going to be like an HMO or a PPO. We're going to talk a whole hour on Part C later on in the training, but there are far more than just HMO and PPO plans. Okay? But the thing that they do have in common is that they combine A and B and usually Part D. Not necessarily, but they will usually include Part D with it. So you've decided, did I want to go with the Advantage or did I want to stay with straight Medicare? So if I stayed with straight Medicare, I need now to get a prescription drug plan, a Part D to go with it. If I don't, I'll get penalized later on if I decide I need one then. So I have to get it when I first start. So you go out and you select a Part D plan. Or if I got the Advantage plan, I went that route, it's usually going to be part of my Advantage plan, but depending on what I got, I may have to purchase it separately. Okay, so, and that's doable also. Now, if I stayed with the original Medicare and the Part D, now I can get a Medicare supplement or a Medicare or a Medigap policy. One of the things that I like and dislike, kind of the two edges there, is that in Medicare, there are so many names and so many acronyms. They do have some very precise meanings. However, you're going to find that our customers don't know the difference between them and will use them interchangeably while they're not interchangeable. Okay, so when I say a Medicare supplement insurance and call it a Medigap policy, I have had customers tell me, oh, I have a Medicare supplement. It's a PPO from Aetna. Okay, well, that tells me right away that you don't have a Medicare supplement. You have a Medicare Advantage plan. But they always, the customer always looks at anything that helps with their Medicare or supplements their Medicare is a Medicare supplement, whether it's truly is or not, okay? So we need to keep those definitions straight amongst ourselves to know that a supplement is a Medigap policy and a Part C is a Medicare Advantage plan. So if you go with a Medicare supplement, you cannot buy a Medicare Advantage. Okay, because there's always the question that comes up with, well, can't I use my supplement to pay my copays from my Advantage plan? No, you cannot do that. So preparing, why do we even want to get into this stuff? Yeah, originally to get into Medicare, you know, back when all the other plans, this was prior to the ACA, you know, you had all the underwriting that had to happen and all of that. Well, all that kind of stuff went away with the ACA. And so, you know, where it became guarantee issue. And now that everybody's losing their employer-sponsored plans, it's a booming market in the short-term market right now. And so you'd say to yourself, you know, why do I even want to get into it? I mean, I'm making good money right now selling in the under 65 market. My answer to that is why let them go when they turn 65? Why not make an easy $500 pop for, that's your commission for, you know, selling something like a Medicare Advantage plan when they first age into Medicare, and then another $250 a year as long as they stay in the plan and stay with it. So that's the, you know, the residual trailer, the renewal each year, another $250. Now they pay the initial when they first sign up into Medicare, they pay that commission up front, and then they pay after they renew. That residual commission is paid monthly. So kind of look at it this way: $250 works out to be just a little over $20 a month. I'm going to call it 20 because that's easy math. And if I had 500 customers paying me $20 a month, isn't that $10,000 a month? I mean, that sounds like a good trailer to me. So let's kind of take a look at this market and see how we get that going. So if you're new to Medicare or selling insurance or both, you're probably wondering, why do I want to get into this? It's complicated, full of rules and regulations. Well, we're the front end of the baby boomers beginning to turn 65 back in about 2010. Now, the baby boomers are all of those who, when their parents returned from the war or from the factories, and right at the around 1945 and on, all those men came back and the women came back, and the women came out of the factories and wanted to go back home and get married, etc. They all started having babies, and it was the biggest population boom that the country had ever seen. So in 2010 was the front end of that group turning 65. Now, we're at that steepest part of that curve there. If you look at the aging curve, it's between 2010 and 2030. We're actually bringing in about 10,000 new eligible Medicare people per day. A little over 3 million a year are aging into Medicare. In 2010, the population over 65 was 1 in 8. 10 years from now, in 2030, it's going to be 1 in 4. So I think that is too large of a market to ignore. Okay. It's just too much money to be made there. So Medicare is usually kind of looked at as far as the market goes in these different little sectors that are out there. Now, the biggest group is that employer-sponsored group. Those are the people who work for some big Fortune 500 company or were members of a union that provided some sort of medical upon retirement when they retired. But what's happening in that market is that, some of them are welching out on it, like the city of Chicago back in 2017, literally dumped all the retired police and fire onto the open market to go out and get their own plans. They just stopped doing it. It's still tied up in court, but in the meantime, all those people had to go out and get their own plan. Okay. All these unions and employers are finding that these medical plans are just too expensive to maintain, and have been slowly letting people go, or they've been raising the individual cost inside the plan so that people are leaving them. Okay. Now, the other big section of that, of the pie there, is those who already have a Medicare Advantage plan. And we're not talking about people coming into Medicare, we're talking about those who are already there. Now, of that, statistically, we know that 1/4 of them, or 25% of those people, that 11 million, are going to change their plan each year. Okay. So what's happening is things in there, their doctors move, their co-pays go up. I mean, they just want to go out and they shop around and they get a new plan. Maybe they were in an MAPD, and Medicare Advantage with prescription drug coverage, and now the new drug that they're covered is not covered by that plan. So they want to find the plan that does cover it. Things like that are causing those shifts every year. And so the advertising that you see that's out there encourages them to go out and look and find them. So we want to be a part of that market, and that's usually what launches most people, agents, into selling Medicare, is that opening salvo inside the open enrollment period, where people are making those changes to their Medicare. The next big group is those that are in a Medigap. Now, that's a very stable group, and they don't change very often. Okay, so they're pretty locked in, but that's only about 17% of what's out there. Now the other group up there, the Medicaid, that's about 15% of those that are on Medicare, and they have a standing special enrollment period. So we're able to work with them just about any time of the year. We don't have to wait for them to move or wait for them to age into Medicare. They, we can just simply put them into a Medicare Advantage plan. I mean, there's some rules about when they can switch and that sort of thing, but for the most part, they're eligible right now to go out and get a plan. Okay. And that kind of breaks us down to that other one. That's 10% of the pie that's sitting there right now is eligible to go into something. Usually a Medicare supplement at this point, but they've got nothing at all. They're on just straight Medicare. And so again, once we go back and explain how that A and B works, they're usually pretty ready to go in and get a plan, especially if they've been paying that 20% all along. So here's some good reasons to go out there and sell this product. High commissions and high retention. And I'll break down those commissions here for you in a moment. And then once people buy it, they tend to stay with it. And if they switch, I just want to be your agent and I'll help you through the switch. So I continue to get my retention, okay? Again, 3+ million new people every year coming into the market that need it. And by 2030, it's going to be 65 million, or 1/4 of the medical market itself is going to be Medicare. So let's look at these commissions. This is kind of looking at 2019 and 2020. So let's look at that 2020 column. If you're selling in Connecticut, Pennsylvania, or DC, this year it paid $574. If you took that person who was aging into Medicare, told them how it all worked, and brought them into a Medicare Advantage plan. So you see that it was also, that's almost a 6% increase over 2019. So these, I have another slide that shows how that's working. If you're selling in California and New Jersey, that initial pop is $336 when somebody ages into Medicare. I don't think we've got anybody here that are selling out in the territories, Puerto Rico, Virgin Islands, but if they are, those pay a little bit less. But for the most part, all these other states, $510 pop when you sell them that initial Medicare plan. And the way that works, when they turn 65 and you sell them that plan, that commission is paid in full at the time that you purchase it. When we look over at the renewal columns, you see the renewals here for 2020. Let's just stick with the all others column there. It says $255. That's what I said. These are the ones that are paid out each month. That's long, after they renewed their plan in January. Every month, the broker of record gets their share of our 1/12 of the $255. So that works out to be a little over $20 a month per person that you've enrolled. Now, if you sell them just a prescription drug plan, in other words, maybe you paired them up with a MedSup, the initial pop on the prescription drug plan is $78 for the sale of the plan. And then the renewal is $39 a year. So, you divide that, by 12, you're looking at just an additional $6 a month. So not a whole lot in the prescription drug world for residuals, but it all adds up. Okay. Oop, let's see here. Got a little, so there we go. So looking at, my goodness, what happened here? Let me get that back on here. There we go. Okay. So here for 2021, that national average out there for selling that initial plan for a Medicare Advantage went up to $539. Okay, so another 5.69% increase. Okay? And then the residual went up to 270. So it's even a larger increase, 5.88, almost 5.9. And you can see for if you're selling in Connecticut, Pennsylvania, or DC, those pay a little bit better. And if you're in California and New Jersey, they pay even better. So you can literally make an extra 100, what, 150 bucks there by selling in California and New Jersey on those. The PDPs, the initial pop went up to $81, and the residual went to 41. So still not a whole lot, but it's another 5%. This is kind of that history of what's of how that's been going. And if you look, it's roughly been going up at about over 5% a year. Okay, so there's a good market here that's constantly providing you with even a better and better commission. So how do you get in on this? Well, here's the start. The start is going to be you do your AHIP. Okay, AHIP is a national trade association that represents the the insurance industry, and it provides the certification for Medicare. All the insurance companies that are out there accept the AHIP certification, and if you happen to do multiple, as we get through the training here, I'm going to tell you need to be doing at least 5 certifications. I was doing up to 18, usually spent my month of July and August doing these things every year. But you have to, it all starts with the AHIP. AHIP does have a cost. The cost is $175, but the carriers will pay $50 of that literally right off the bat. And there's some other ones, if you sign up with them, that will not only pay it, they pay the $50 this year, but they'll pay the full cost next year. Okay, so they just want to get you in the door and get you going before they commit to paying for your AHIP. So there's AHIP is made up of 5 modules that go through a little bit about Medicare and the marketing of Medicare. So it's going to provide you with all the compliance rules that you need to know and all the guidelines for selling Medicare. Okay. Of course, I'll give you a little bit of background, but not near enough. You're going to want to attend the webinars coming up in August that'll really break down A, B, C, and D for you, so that that makes the sale even easier once you have that understanding. So anyway, you do the AHIP, and it covers all of those basics about selling Medicare, along with all the rules. First time you go through it, you're going to have to set up your account with them. So you're going to need your NPN, Social Security, all that basic stuff. You have to redo it each year, but the recert is much simpler than the first time you go through it. Yeah, like I said, the cost is $175, but the different carriers, and I'm not trying to plug a carrier. I did Humana, and it was very simple to get that $50 through Humana. Okay, so I mean, but it could have easily been Aetna or United. Okay. You only have 3 attempts on the test, but the test is open book. And if you print out and save all the material along the way, it's pretty simple. One of the things that you can do is each module at the end has a test. It's about a 20-question test upon completion of the module. I always copied made a screen print of that, because after you've done all 5 modules and you go to the final exam, which is the one that counts, the questions are made up from those same ones that you saw as you did the modules. So if you print out, all of those, you'll literally have most of the final printed and sitting in your hands as you take it. Along with, you can print out all of the lessons themselves, and you can look up an answer. But that's kind of, in the 2-hour time limit, it would be pretty difficult to look up all the answers if you didn't know them. So I'd still, do it that way for study. And then you're going to send your results to all the carriers, and they're going to then have you certify on their particular plans. So now, maybe some of you, after I describe that and the cost, aren't really thrilled about, throwing out at least $125 of your own money, but you want to dip your toe into that Medicare pool. Go to United Healthcare and sign up with United Healthcare. They'll carry you through what is covered by AHIP as part of their program. It's just that it's not transferable to anybody else. So if you do United Healthcare's program without doing the AHIP, you're only going to be able to sell United Healthcare from that. And that's not bad. I mean, they're in all 50 states, I believe, and they've at least got a prescription drug plans if you're doing with a Medigap. So you can really, like I said, dip your toe into the water, see if it's something that you like or not. So here's what we're building up for right now, is this October 15th through December 7th. That's the open enrollment period. That's when we already know that about 25% of all the people on Medicare are going to go out and sign up for a new plan. It's just been the statistical average going back for years. So we know that is kind of a given, and that's where most people want to come in, do the work there, and really get that base established, start working the referrals, etc. Okay. All that coverage that you sell during that time period starts on 1 January. So that's why we're calling it the 2021 certification, because all the plans that you sell during the open enrollment period are for next year. Then we spend the rest of the year doing what they call the special elections. So we've got the 3 million plus each year that are coming in for their initial enrollment, plus all the people who do things like move or go get special Medicaid, or they get what is called low-income subsidies, where it gives them abilities. But all these special elections, there are so many of them that we'll spend about an hour come December at the end of open enrollment. Usually that right after December 7th, we do the special enrollment period webinar, because that's just going to get you all prepared for selling throughout the rest of the year, because that's going to be special enrollments and new people to Medicare. So now people that are aging in, they've got a huge window. So they have to first, remember, you had to have A and B. So they've got a 7-month window to enroll into A and B. Okay? So that starts 3 months prior to the month of their 65th birthday. Then you got the month of their 65th birthday, and then 3 months afterwards. So they got a 7-month window in which to enroll in Medicare. And so that then, once they have their Medicare card during that same time period, is when they can enroll in a Medicare Advantage plan or buy a Medicare supplement. Okay. So all of those at that time, it's all guarantee issue. There's no underwriting. Anybody that applies will be accepted, etc. Okay. So they're not bound by any of that AEP for enrollment. In fact, AEP will be their next opportunity to make a change afterwards. And so we all know that the people coming in are all pretty wired, been around computers for a while now, and pretty much know how to do stuff over the internet, and are pretty likely to buy from you over the phone and online. So the switchers, these are the people that we're dealing with coming up here for open enrollment. Now, a lot of times, these are kind of just a short list of all the big reasons people want to switch during the open enrollment. They've had cost increases. Maybe their premium went up, or the pharmacy closed and they have to go to a different one that's not part of their network anymore, or consolidations that went on, or their co-pays are higher, their co-insurance, all the reasons that we see listed there about money. Maybe the company they were in left the market. When they say the elimination of first dollar, remember that prior to those entering Medicare, prior to 1 January of this year, had available to them a plan that even covered the deductible, the Part B deductible. That's no longer true. So we don't have first dollar coverage anymore. So many of the Advantage plans, you've all seen Joe Namath on TV. They offer so many different stuff in their plans anymore. So a lot of people are excited. They want those extra products that are in there, everything from gym memberships to over-the-counter drug coverage. Or their provider. When I say their provider, I'm talking their doctor. The doctors tend to, kind of come and go a little bit from the various plans. Maybe they were, they were taking United, and the person was in United Healthcare, and for whatever reason, now the doctor doesn't take United anymore, and they take, Humana. So the customer themselves is wanting to change plans so that they can keep their doctor as part of their network. Or maybe they moved, but moving takes us to that special election period, and that's change in residency. Now this is almost like all the ACA stuff there, as far as what happened. You moved, or new things became available went up on the move. You maybe didn't lose the coverage that you had, but new things became available when you moved because you moved to a separate county. If you moved from one house and you moved down the street, it probably wasn't going to qualify. But if you moved across town and maybe changed counties and your zip code changed and now there was new plans available, I have seen plans available, people that lived on county lines where a plan was available on one side of the street and not on the other. Our release from jail, again, that's just like the ACA stuff, okay? Low income subsidy. That is a special program for people on Medicare whose income is within certain parameters, not low enough to go on Medicaid, but low enough that drug costs become too significant for them, and the government will help out with some what they call the low income subsidy, which also gives them a special election. So we really like to work with those folks and help them get into that. Or sometimes plans terminate and leave an area. Okay? Credible coverage refers to the prescription drug coverage. Okay, so if somebody they were in one of those union plans or retirement plans from one of their companies, and for whatever reason it's no longer as good as the Medicare plan, you'll get a letter that says that you no longer have credible coverage, and that gives you the opportunity for a special election. And dual eligibility are for people that have both Medicare and Medicaid. Now, when it comes to special election periods, low income subsidy and dual eligibility, each one of those, we do have about an hour long webinar that talks about how to take advantage of that. So, kind of what now? Okay, kind of I sold you, you decided that, okay, yep, I would like to do the Medicare, now what? So start off with kind of a marketing plan there. You're gonna put it on your website, familiarize yourself with the how to quote it and how to do the carriers enrollments, put an email tagline on your email signature. You want to contact those people that you already do business with. Medicare has a no solicitation rule. However, calling existing clients is servicing your customer. So you just want to get a hold of them, and it's not considered soliciting your current customer if you call them up as they're turning 65 about their Medicare. And of course, if you're dealing with centers of influence, doctors, CPAs, lawyers, your church, you definitely want to let them know. Who do you want to get certified with? What carriers do you want? I had mentioned earlier that you probably want about 5. So let's kind of break that down. The big national carriers are United, Humana, and Aetna. You want those 5 carriers. Okay, they're just about everywhere in the country, and if you go to any particular area, it seems like the doctors are going to be taking one of those at least, if not multiple, but at least one of them. Okay, so that's what you're really driving home. They don't all cover the same prescriptions, so sometimes that'll be a driving factor, will be the prescription coverage. But those are the 3 big ones. Then there are regional coverage, and by regional, think of Blue Cross Blue Shield. Each one of those is part of its own state, right? There's Blue Cross Blue Shield of Wisconsin, Blue Cross Blue Shield of Illinois, Blue Cross Blue Shield of Indiana, and there's Anthem, which is still one of the blues, but it's just a different group. In fact, I think it's Anthem is Indiana, but anyway, you get the picture there. So you're going to want to be able to handle some of the blues, whether it's Blue Cross or Anthem, maybe Cigna. Cigna Health Springs is the Medicare Advantage plan that you would want to be looking at. They're big throughout the East and Southeast at least. So you want to be looking at those. Maybe you're big in Texas. Okay, so Texas has the plan that's centered around Baylor Medical University. Okay, and so that's Scott and White, and they're not throughout Texas, but they're there in the Dallas, Houston, Waco, Central Texas, and some of northeastern Texas, along through there. And so that's a very big and popular plan there. Or maybe you sell in Oklahoma. Okay, there's Blue Cross Blue Shield, there's United, but then there's Global. Global is kind of one of the low-cost carriers throughout Oklahoma. Or you're out west in California. Scan is big and popular. Or if you're in Monterey, the only plan in Monterey County, California is Aspire. So you want to look at that. But the picture is that there's a lot of little niche companies that you might want to look at if you're selling in that area. Okay. So what you have to do is contact the broker services. Just Google it. Broker services, contact them by email, and they will let you know what you got to do to certify, especially this time of year when all their certifications are open, and they're very geared to certification right now. We'll talk a bit about that here in a moment. But the carrier will let you know by email what you got to do. Sometimes it's an online, do a course. Sometimes it's face-to-face. Attend a class, some of that kind of stuff, or a combination of both. I think a bit of it's changed because with what's going on right now with COVID-19, I don't think we'll have too much face-to-face, but I've seen it done via Zoom also. Okay, so AHIP is that common core of all of the different plans, and you send it to each of the carriers, and that cuts out a big portion of it, like especially if you were doing like United, who has their own certification. If you do AHIP, you cut out about half of their training. Now, when you do these certs, you want to do them one at a time. And that's why I was telling you, I normally spent July and August doing these, because it's September and October, the drive of the plan is much different. Right now, they want agents, and they're trying to build their sales force for 2021 for that open enrollment. Okay, but the new plans have to be out and available by the end of September. On 1 October is you can't enroll, but you can start shopping. So so they have to have everything out by the end of September or the beginning, so that customers can start looking at the plans. They can't enroll in them until October 15th, but they can start getting that early look at them. And there's a lot of people that are going to want to do that. And so my point is building the sales force is what they did back in July and August. In September, they're starting to print all the materials. They're getting that on out. They're answering Salesforce questions. They're doing that. It's not that they don't want to certify people. They always want to do that, but it's not their primary, and they slow down. What that turnaround went from a couple of days to 6-8 weeks before you got a certification. And by that time, open enrollment is almost over. Okay. But when you do these certifications, you just copy, take notes, write it all down, screenshots. They're all open book, and but they all have some pretty high bars to get across. Okay? So take your time on all the tests. I mean, I don't kind of tell everybody about how the test taking, but I'm sure that you've done that. Save all the certificates, and like I always said, the RSVP for any live certifications is available. I'm not sure that you'll see much of that anymore, maybe via Zoom, but I don't anticipate going able to sit down with the local headquarters where you live and being able to get certified on the spot there anymore. Okay. So that's kind of the way the Medicare market looks, but let's look at the Medicare supplement plan, because it's going to give you a lot of insights into the how things work there too. Okay. So what we're kind of looking at here is the Nat Gen supplement. They're all the same. You're going to find that all of these different plans, when it's a plan A is a plan A, a plan G is a plan G. It does not matter what company you buy it from, it's the exact same plan. Now, some plans are easier to get through one company rather than another, especially if you have to go through underwriting. But I normally would sit out there, I'd use a quoting engine, find who's cheapest, and sell them that plan. A few people would come in and they would want a specific plan. I want the AARP plan because that's what they saw advertised. Okay, so but there's a lot of plans out there. So now Medigap plans help pay for Medicare covered services. Let me reemphasize that. Medicare covered services. If Medicare does not cover it, this plan will not either. Okay, an example, cosmetic surgery. Medicare does not cover cosmetic surgery. You're not going to get a Medigap plan that's going to cover that. Okay, it has to be covered by Medicare. But with it, you can go to any doctor, any hospital or provider that accepts Medicare. So the plan itself is really just going to help with those things like the co-insurance, the co-payments, and the deductibles. Okay. So this slide kind of speaks for itself. It's kind of what it's going to do. It's going to protect you against that out-of-pocket cost. Remember that Medicare itself had you paying 20% out of pocket with no end in sight. I mean, it's not like, at the end of the year, it starts over again or anything, you paid $5,000 and now it's stopped and it was fully covered. No, in Medicare, you pay it until the cows come home, okay? With a Medicare supplement, they're going to protect you against all of that. And that kind of lets you focus on getting well. Now, the cost of that plan is going to depend on quite a few things, though. It's going to depend on your age in some states. Some of them have a little age weighting in there, but predominantly where you live. Is it urban? Is it rural? They're going to want, what's the zip code? I always said that, try to always pick that middle of the country city. If you lived in Wichita, Kansas, your cost for medical costs are far less than those who live in New York City. Okay, so that's going to be reflected in the premium that you pay for that Medicare supplement, even though that same company is sold in both places. Okay? And again, the company selling the plan, some are just have higher costs. So the premiums may vary greatly for the exact same coverage. Now, some companies do offer different discounts. Some it's for being female, for being non-smoker, or for being married, and medical underwriting for those who have to go through underwriting. Can have some cost changes there too for pre-existing conditions. They didn't go into their Medicare supplement when things first started like they should have. And so it says no waiting period. Well, that only applies if there's no underwriting. You could have a waiting period for a pre-existing condition. Yeah. Keep in mind, though, that even if you had a pre-existing condition and they said that they would not cover that, Medicare itself is still covering it. You're just not getting that 20% coverage paid for something that you had a pre-existing clause for. Okay. Yeah, Medicare itself is not, excuse me, not the Medicare, but the Medicare supplement is not a standalone plan. It does require that you are enrolled in A and B. And if you're married, you can't get a family plan. Your spouse has to purchase their own separate policy. Again, they're sold by private insurance companies. And you have to have original Medicare to begin with, and then the supplement will come in and help pay for the things like the deductibles, the coinsurance, and the co-payments. Now, all Medigap policies must follow the federal and state laws that protect people with Medicare. Okay. Yeah. Let's see my notes here. Okay, so what we're going to look at here is this kind of a chart. So the way that the Medigap plan covers Part A. Now, there is a whole alphabet soup of Medicare plans, and they literally run A, B, C, D, F, G, K, L, M, and N. Those are the current plans. What we are going to want to sell are either Plan F, Plan G, or Plan N. Or we'll sell them a high deductible Plan G. Okay. It gets confusing as to whether it's a high deductible F or a G. It really doesn't matter what you want to call it. It's still that same high deductible plan, and that you have to meet the high deductible, which is $2,300. Okay. So the other plans like M, L, and K are are paying like 50%, 75% of what. I mean, it's just no real good justification for selling those plans. Either we're going to cover it all, or we're going to get you into a high deductible. When it comes to Plan A, and the only reason Plan A is shown here is because if you're going to, as a company, sell in the supplement market, you must have a Plan A. Okay, that's just one of the rules that CMS put out. So this is NatGen. NatGen sells Plan A, F, G, and N. Okay, so we'll take a look at those, and you'll see, looking there on Part A deductible, that Medicare, if you're on straight Medicare all by itself, that's your deductible, $1,408 if you're hospitalized. We talked about before how that is an event deductible and not an annual deductible. So if you have any of the supplements, F, G, and N, they'll pay that for you. So Part A deductible, $1,408. however many times you need to have that paid each year. Like it says, an individual could pay it 4 times if they got all the conditions right, kind of worst case scenario. But that's going to be paid by the supplement. After 60 days in the hospital, okay, so the first 60 days were covered by that deductible, so you didn't pay anything. Now, on day 61, Medicare itself pays all but $352 a day. The supplements all pay that for you. So Medicare paid everything except, and now the supplement kicks in and pays that $352. Between, after you've had up to 90 days in the hospital, so you've been in the hospital for 3 months, on day 91, Medicare now pays all but $704 a day. So that individual, on top of being sick and not working, has to pay $704 a day. Unless they got that coverage, plan F, G, or N, all will pay the $704 a day for you. Now, Medicare itself, once you hit 150 days in the hospital, it's over. Medicare no longer pays any of it, and you're responsible for everything. Now, if you have any of the Medigap plans, you'll see here that Plan F, G, and N all pay 100% of the medical costs for an additional 365 days. So you could literally spend the year in the hospital. Okay. Now, Medicare itself, when it comes to needing blood, covers all the blood except for the first 3 pints. Okay, so one of the things that if you go out and Google, what's the average amount of blood used for a surgery, you'd find that it is like 2.8 pints, something like that. So for most people, if you're on just original Medicare, you'll pay for that first 3 pints of blood. Then if you have any of the supplements, you don't pay any. Okay, it's covered. Supplements aren't going to really help out if you go to a hospice because Medicare covers you in the hospice. Okay, this is all but limited to coinsurance and co-payments for outpatient drugs and inpatient respite care. So for most people, the patient is covered under Medicare for hospice. Skilled nursing facility. This is a biggie, okay? And it all starts with, in order to even qualify for that skilled nursing, you needed to have, 3 days of inpatient hospital. So you had to have gone to the hospital for 3 days, then you can be transferred to a skilled nursing facility. Medicare covers you at 100% for the first 3 weeks. So you get that first 20 days, you pay nothing. But from day 21 to day 100, Medicare pays all but $176 today, per day. And the supplements, F, G, and N, will all pay that $176. Now, after 100 days, nobody's going to cover you. Not Medicare, not your supplement. Because remember, if Medicare didn't cover it, the supplement isn't going to cover it. You'd have to have something separate to cover that. But 100 days in a skilled nursing facility could be handled by your supplement, and it wouldn't cost you anything. Now, Part B. So Medicare, Part B has the $198 deductible, and only Plan F covers the deductible. Okay? Nobody else will do that, and anybody starting Medicare, like I said, after 1 January of 2020, cannot get a Plan F. So you'll see that the deductible is the deductible, and everybody has to pay it. Now, Medicare itself, when you use your Part B, after you've met your deductible, pays 80% of all the approved charges. Okay. Well, the supplements will pick up that 20% for you, but with the exception of Plan N, which has a copayment. Okay, so $20 copayment for a doctor's office visit, $50 for an emergency room visit. And on that doctor visit, it doesn't matter, primary care, specialist, you pay 20 bucks when you go. Okay, and hopefully what you're making up for, though, is on the premium difference. Okay, for somebody who goes to the doctor a lot, Plan N is probably not going to be the plan for them. Now in Medicare, the way that the charges work is all by the medical billing code. And Medicare has a table that says, how much that they will pay. So that's the Medicare approved charges. Well, they allow doctors to charge 15% above that. So I always like to use, in my example, it's $100. It's going to be your approved Medicare charge. And so the doctor charges the maximum, though, he can go 15% over that. So he's going to charge $115. Okay. So if I was on straight Medicare would pay 80% of the Medicare approved, which was the $100. So they paid $20. And then I have to pay that additional $15, right, myself, because they didn't cover that. So when it comes to excess charges for that $100 charge, my share of that bill would be $35. Okay. If I have Plan F or G, they pay that excess charge also. Now you notice that Plan N does not. So one of the drawbacks to Plan N is you can get dinged with all these little charges along the way in there that that could be a percentage up to 15% above what Medicare allows. So just something to note, especially now, if you live in a state that does not allow doctors to bill beyond the Medicare charge, and there's a few of them out there that have laws in place that don't allow, on a state level, they don't allow the excess charges. The federal says they can, but then that state says that they cannot. So you have that makes that Plan N really attractive for people that live in that. And then, like I said, they cover the blood. I just wanted to throw this in because here during COVID-19, one of the questions that comes up with is, remember to go to the skilled nursing facility. You needed to have that 3 days in the hospital. Well, if you notice that in the note there, it says during the COVID-19 pandemic, some people may be able to get renewed skilled nursing facility coverage without first having to start a new benefit period. And if you're not able to be in your home during the COVID-19 or otherwise affected by the pandemic, you can get into the skilled nursing facility without the qualifying hospital stay. Okay, so for some people, they wind up in the emergency room, but instead of going and getting the 3 days in the ICU and then get transferred to the skilled nursing facility, they could go directly to the skilled nursing facility, trying to take some of the load off the hospitals. Okay, now home health care, that's going to be covered pretty much by Medicare, so that these plans, they don't have to pay anything for that. But these durable medical equipment, if you just needed crutches or you needed a wheelchair, not a big deal. But then think of things like CPAP machines or home dialysis, or if you're diabetic and you need all the monitor, I think all the stuff that comes under for diabetes is going to be the needles, the test equipment, the lancets. Those are all considered durable medical equipment, and you're going to be covered entirely inside of one of these supplements. okay? And the last little area here that's covered that you don't get anywhere else is coverage outside the US. Okay? Medicare itself does not cover you if you leave the country. If you have a Medicare supplement, though, you're going to get a $250 deductible and then an 80-20 plan with a lifetime max of $50,000. So for the most part, what they're looking at is let's get you stable while you're outside the country and then return to the country for treatment. Okay, so that's your emergency coverage, which if you don't have a supplement, you're probably going to want to be purchasing that travel insurance. So as far as eligibility for one of these, you're just going to have to meet this. You have to have your A and B. And an applicant who is age 65 or older may be eligible for the guarantee issue in the Medicare supplement, depending on events, okay? But the best time to buy is during that first 6 months, okay? Yeah, remember you had the 7-month window to enroll in Part A and B, okay? When it comes to the supplement, once you're the month of your birthday, you get the first day of the month in which you turned 65, and it lasts for 6 more months. And like I said, begins on the first day of the month that you turn 65 to be able to enroll in a Medicare supplement under the guarantee issue rules. Now, for those who stayed, in an employer plan, that rule gets modified to when they left the plan and started their Part B. Okay, so that's when the 6 months would start. Okay? But it's, you have to be 65 years or older. There are states that require it for under 65, but I want you to be really careful with that. You want to go in and you want to read about each particular state. Some have no ability, and others will say you can enroll in Part A. And others will say you can enroll in any of them. Of course, the Part F one dealt with those who entered Medicare prior to January 1st of 2020. So remember, original Medicare, even if you do have a restriction, where you got underwritten and they wouldn't cover, your diabetes for 6 months, although that's probably not a good example. You're still covered by original Medicare until that restriction goes away. And that's pretty much it, okay? I hope, Lee, that you guys have seen the light and you will want to enroll in Medicare. If you do have any questions, just feel free to send me an email, okay? And I can answer your questions by email if you do have any. And that would be to email training@ahcpsales.com, and I will answer your questions there. All right, you guys have a great day, and thank you for listening.